Good evening, I'm Lou Goldstein, and welcome to part 2 in our interview with Jeannie Miranda on myofascial release and physical therapy. And we're very excited to have you back here to continue our discussion. We had a great discussion last week about physical therapy and myofascial release. And Jeannie has had over 35 years of physical therapy experience. She's opened up her new office, Turning Point Therapy, in New Hope, Pennsylvania. And we've talked a lot about the benefits of myofascial release as it affected her personally, and through curing migraines and helping to cure migraines, and how it affects the entire body. And so we're going to continue our discussion now with Jeannie and talk a little bit more about the various types of physical therapy and how you can benefit from this. So it's well worth your while to continue listening to this, because if it's not you, it may be something that you can pass this on, or you can pass Jeannie's number on. They can contact Jeannie, and she does a free 20-minute phone consultation too. So that's important to know. So, but first of all, let's get back and talk a little bit about, for those who missed the first episode, they shouldn't have, but they may have. But what is myofascial release?
So myofascial release is a specific type of hands-on approach and we focus specifically on the fascial system of the body. What happens is we apply gentle sustained pressure at areas of restriction within the body to help release that restriction and rehydrate the fascial tissue. That can in turn allow for greater mobility, greater function, and it can take pressure off of pain-sensitive structures such as nerves, blood vessels, organs, things like that. Fascia can get restricted with it can get restricted from postural habits, from overuse, from inflammation, from trauma, physical and emotional trauma. And a restriction the size of a postage stamp, just 1 square inch, can cause up to 2,000 pounds of tensile strength or pressure.
That's a lot of pressure.
It's a lot on a system. So it's not a matter of getting strong, it's a matter of releasing that restriction to allow for the mobility and allow for the rehydration of the fascial tissue. So with the myofascial approach, what we do is we look at the body, we look for areas of restriction, and then at that point in time we treat those areas of restriction with gentle sustained pressure. The fascial system is our protective system, so we can't come in and force it. If we force it, we're engaging that fascial system, and it's not going to release. So it's gentle sustained pressure at the areas of restriction, right. And the areas of restriction might not necessarily be the area of pain. Pain is a way that our body communicates to us that, hey, there's something wrong, you got to pay attention.
Right.
And sometimes it might start out with a twinge, and then then eventually, when you keep on ignoring it, right, it becomes a loud scream. And so a lot of times, if we don't ignore that, but that might just be the source. Might not be the source of the fascial restriction. It might just be where the restriction is kind of coming out. So.
Okay. Yeah, and I know you had a lifelong battle with migraines.
Yes.
And that was something which you found beneficial once you got to myofascial release. And maybe you could just give us a shortened version of that for those who do suffer from migraines at home.
So I was a lifelong migraine sufferer, on all kinds of medications, been through different varying degrees. I had a daily medication, an abortive medication, and a rescue medication. Oftentimes I needed to use all of that. I could have up to 12 to 15 migraines a month. And that was quite debilitating. So I did not like the effects of the medications on my body, and I had decided to try an alternative route. I did try myofascial release, and it was a game changer for me. I am migraine-free, medicine-free, and have maintained that for almost well over 6 years now. And from having suffered all of my life, myofascial release was a game changer for me.
And you found out that the point of pain was not in your head, though, right?
Not at all.
Right.
Most people, and that's probably why it was never taken. I could never get rid of the migraines, because the source of the pain was actually from a fall when I was a couple of falls actually when I was a young child, and I broke my coccyx, and so that created such a pull on my dural tube, which is the deepest, or the dura, which is the deepest layer of the fascial system, and that surrounds the brain and the spinal column. So that pull was something that kept me in a state that made me very susceptible to the migraines.
So, from just a couple of incidents when you were a young child, from the base of your spine was causing everything that was, causing you to really, have those migraines. Yeah.
Yeah.
So, a lot of people, I'm sure, ask you, who can benefit from? I'm just call it MR.
MFR.
MFR. It's a long time to say myofascial release. So, who can benefit from MFR and treatment?
So MFR, anybody can benefit from MFR. From infants to adults, it doesn't matter. Some people say, why infants? They haven't had any injuries. You don't have to have an injury in order to receive myofascial release. Oftentimes, there's a lot of, because of my pediatric background, a lot of my clientele base is infants in my office. A lot of times, because of intrauterine positioning or difficulty with birth, there are like delays with birth, or even C-sections, that can cause a lot of problems with children, and or infants, and you'll see it in terms of difficulty latching with a mom, colic, GERD, different things like that. Eventually, as they get older, you might see it in terms of torticollis or things like that, or plagiocephaly, which is like a misshapen head, and those are things that from just the intrauterine positioning and maybe difficulty birth, rapid birth, things like that, is that birth, essentially birth is the initial trauma for a child, because it's a complete change in environment, so, and even though it's beautiful, it's an initial trauma, and that trauma, that trauma can cause restrictions within the infant's body. So we've also found that as we work with children early on, there's a different kind of resiliency. I don't know that it can be measured by our traditional measurements, because fascia can't really be seen on X-ray or CAT scan or MRI or anything else like that. So I don't know that it can be measured, but we've noticed that there's more of a resiliency with the children that have been treated with myofascial release early on, as opposed to adults later on in their life. So. And I think that is just because it allows the body to really be without restrictions right from the start.
Okay. Just getting back to trauma for a second. Do you know if any research has been done, or there's any proof as far as the type of delivery? In other words, having a cesarean section versus, vaginal delivery, as far as the amount of trauma that an infant will go through?
I don't know necessarily if there's specific studies with that, but what happens with a C-section is in the womb, there's a certain amount of pressure in that womb, and all of a sudden with a C-section, the whole system is depressurized. Okay. So that is a trauma. Sometimes with vaginal deliveries, there can be the normal vaginal delivery, but sometimes each stage of the typical vaginal delivery is doing something for the baby. And if some of those stages get fast or slow, or get caught, or shoulder gets caught or something like that, that can produce restrictions, because the body is going into a protective mode. Sometimes I truly believe as I said to you, the deepest layer of the fascial system surrounds your brain and your spinal cord, and I believe that the first vaginal birth helps to truly unwind that whole system, so that there's no restrictions within those deep layers of that fascial system. Okay,
so let's talk a little bit about your office and the new business, Turning Point Therapy. Some people may question, why, how is Turning Point, therapy in the last year since you started in April, last April, how's it different from the traditional? PT?
So in Turning Point Therapy, it's a holistic physical therapy practice. We focus primarily on myofascial release. And so what happens is that you'll come into the office, it's a one-on-one treatment session. Okay. It's not, you're not in the office with anybody else but you. And what we do is the myofascial release being gentle, sustained pressure, it's just hands-on approach for this treatment session that you're in there. I look at your body first. I look for areas of restriction, areas of misalignment, areas of limited mobility. Right. As a physical therapist. So I will take out my goniometer, measure, and check out muscle strength and things like that. However, I'm primarily focused on dealing with the fascial system in terms of treatment. Okay,
and as far as treatment, you had to study the MFR treatment. And where did you go to study this, and how did you learn it?
So with it, it's many hours of treatment of study with this. I first learned about the fascial system way back in school, but what we didn't know about the fascial system, we just thought it was an insulator. We didn't really understand the fascial system when I went to school. All of my training in myofascial I took through John Barnes seminars. Through that, and there's different levels of training with that. Someone that takes just an introductory class would be considered a novice, and then there's someone that takes a few more classes would be considered intermediate. Right. Further on down, probably probably about 6 or 7 classes, you'd be considered an advanced practitioner. I'm considered an expert myofascial release therapist. I've taken all of the classes that's offered within the John Barnes approach, and along with that, I've studied. We do a week-long intensive where we get treated ourselves. So so I'm speaking from experience as well as a therapist in treating. So and then we also have a week where we study specifically in their clinics, and then specifically go over and refine our techniques.
Okay, and then do you have patients that you work on during that time too?
The whole time.
Yep. Yeah. Okay, so you talked a little bit about what to expect at your first MFR session. You haven't talked about whether it's going to hurt. Is this going to hurt?
So myofascial release, because it's gentle, sustained pressure, it doesn't hurt at all. So we can't force a system. The system is a protective system. It's tied into our autonomic nervous system, which is our fight or flight system. If we were to force it and come at it with a lot of force, you're going to engage the system, and you're not going to be able to release that system. So it's always gentle, sustained pressure. That being said, because it's also tied into the emotions that we hold at a cellular level, sometimes the fear of releasing those emotions or going through those emotions again can be painful, and it can never injure you because you are not in the same situation, but your body doesn't know that it's necessarily not in the same situation. So sometimes it can feel like that same hurt.
Okay. So what other type of issues have you treated? I mean, have you treated people for, I don't know, GERD or any digestive issues or various other medical issues? Have you treated people for different things?
Really, so in Western medicine, we look for the diagnoses, and so everything has a nice, neat label. And there's many people that come into the office with lots of labels. Okay. And be it GERD, be it fibromyalgia, be it like rotator cuff problems, knee pain, whatever, a herniated disc, all of those things.
Wherever it hurts.
Yeah, right. And the thing is as you come into the office, I'm going to be aware of that, be aware of your history. However, I know that where your source of pain is might not be the source of the problem. So, or where you're experiencing the pain, it might not be the source of the problem. So I know to take a look at the whole entire body. And again, that's what differentiates my practice from a traditional physical therapy practice. I'm going to look at the whole entire body and treat that whole body with what I see, with as it needs to be. Sometimes a shoulder pain can be just coming from a hip that is anteriorly rotated,
right,
and malaligned, and just not in good alignment.
Yeah.
So once that alignment comes back, then everything can function, and the restrictions are released that's keeping it there, then everything can function as normal.
Okay. Now, you mentioned before that MFR is a hands-on technique. It's not performed without any lotions or oils.
No.
And it's, basically directly on, bare, dry skin. So can you talk a little bit about how long each is an average session, and when people can notice changes?
So each session, sessions typically, in my practice, typically if you come in for one session, it's going to be an hour long, and it's direct one-to-one treatment, hands-on treatment, that pretty much that whole entire time. If I need to teach you some self-treatment techniques, then that might take a little bit of that time. So a typical session might be an hour long. What we found too is what I also do is I also offer what I call mini intensives, because it is gentle, sustained pressure. You can tolerate up to 3 hours of treatment a day without a problem. So sometimes if someone has a very chronic illness or a very difficult situation, I might encourage them to come in for an intensive or a mini intensive, so to allow for them to have multiple sessions in a row. The more sessions, the more we can catapult the gains. So if I see you once a week for an hour, we can make changes, and you're going to feel good, and you're more than likely going to feel good the minute that you step out of the office. But what'll happen is sometimes if we can't make changes fast enough, and you go back to the same things that brought you in. So let's say you're chopping wood and every single day, and you're chopping wood,
right,
and then I see you only for an hour every other week or every week, and
right,
you're still going back to chopping wood. Unless we can make changes to that repetitive motion, then it doesn't mean that you quit your job, but it just
right,
means that we have to make changes to your structure to allow for you to do it in better alignment. So
Okay,
so
that's
that
good.
type of thing. So.
Because I was going to wonder, how often does a person get treated? And I think, it depends on each individual. I know it's different.
It's very individual. I would love to say, if you come in and see me for 4 to 4 weeks, you're going to be great. It's like, realizing that a lot of these labels come with many years of stacking, of
Right,
things that have stacked on top of them. So as we peel away layers, it's kind of like peeling away layers of the onion. It's like as we peel away those layers, we might find that, oh, wait a minute, there's something deeper underneath that really needs to be addressed. So I might be able to increase your shoulder range of motion so that that you don't have a pinch,
right,
and I might be able to get your alignment, but really there might be something something deeper or something more emotional that's keeping that coming back, so.
For patients with multiple issues, like maybe it's something with their ankle, or something with their knee, or something with their shoulder, or maybe they have migraines, right? And they come into you and they say, Jeannie, I need help. All these things. How do you basically structure the treatment, and how do you attack each of the areas of the body?
So
maybe attack is the wrong word. How do you treat each of the areas of the body?
It's never, because the body's all one in
Right,
one piece, and the fascial system touches every single cell of our body. Sometimes it might seem overwhelming for someone else to say, like, oh my gosh, there's so many things going on and I don't know what to do first.
Right.
What you can do because the fascial system is so interconnected, no matter where you treat, you're affecting a change further on down the line. So no matter where you treat, you do that. What I do is, when I take a look at a person, I look for things, I want to get their alignment set first, because the body is designed to be efficient in good alignment. alignment. So if I can get that efficiency on my side, then that works out good. Right. So I want to make sure the alignment's set and stays set, so that way we're not going back and forth. And when your body's in misalignment, you're going into your holding patterns, and those are what is unique to you, or your bracing patterns, and then that will help perpetuate that vicious cycle, So if I can break that cycle and break those holding patterns by gaining mobility and gaining fluidity within the fascial system, reducing those restrictions, then the body can function much more efficiently.
Okay. Could you give some information out as far as how people can contact you?
Yeah. So the best way to contact me right now is by phone. I don't have an online scheduler yet, but by phone and or by email, which is Turning Point Therapy. But my email is tpttherapy@gmail.com. Okay. My website is www.myofascialpt.com, and it's FASCIAL. So yeah, that for the fascial. Some people think it's a facial, but it's fascial. Right. And then my phone number. So
okay, that's good.
Okay.
One of the things I like to ask all my guests is there anybody in your life who has served as a role model for you, who's been an influence for you, and that's something that you can share with us?
I've been very blessed. I've had many role models in my life, and I've had many people that have been very pivotal in my life. Even in the field of physical therapy, I've been blessed with studying under unbelievable masters of like forerunning thinkers, So John Barnes, I studied exclusively. All of my training has been exclusively under him, right. And that's very pivotal. Like he was a masterful healer. Yeah. My energy mentor is a masterful healer as well, and she brought me into helped me to expand my knowledge of the energy systems that surround our physical form. So, and I think that only enhanced my ability to help facilitate someone else's healing. So, that I consider myself very blessed with that, And then there's other people personally in my life that have just been so grateful to have as a part of my life.
That's good. That's great. That's good. Now I know you went to Quinnipiac, mm-hmm. and you focused on physical therapy for many years, and you've held different jobs, whether in pediatrics or in NICU units or school and outpatient settings. What's been your most satisfying role outside of opening up your own business?
Okay, my most satisfying. I love being able to work within the myofascial world. I've taught for the pediatric myofascial release classes, and I've helped to instruct other therapists in this, and I love the one-on-one connection. Through COVID, I realized when everything got shut down and kind of changed our worlds, right. I realized that I really love what I do. So I want, and that's kind of what prompted me to go ahead and open up my own place, because I really enjoy the one-on-one connections that I create with my clients and that I have with my clients. That to me is the most satisfying thing that I can do, Right. So that's, I don't know that it's in a specific setting per se, but it's more the clients that I can reach.
What was it like opening a business really at almost the height of the pandemic? And now, hopefully, things are getting better, and, at least we have, a little bit more, hold of what's going on health-wise. And how do you see people coming back to the office, more people coming out of their house, or are people still afraid to come out of the house?
Most people are not afraid. In our office, the policy is if you prefer to wear masks, then I will mask. Yeah. But most people are not afraid to come out now. What I'm finding is that a lot of people, there's a level of anxiety from the pandemic that a lot of people are experiencing, and they just feel a disconnect within their physical bodies. And so there's a lot of generalized aches and pains, but they can't necessarily have an overarching label on it, you know. And I'm finding that a lot. Opening up my own practice during the pandemic, there's many times, many days, like, are you crazy? Am I nuts? But the bottom line is I realized I really, really enjoyed that one-on-one connection that I could get with a client. I don't like to have a big, gigantic room and have a bunch of people in a room trying to, you do this and you do that and you do this. I like to have that one-on-one connection with my clients, and really work it individually with them, not follow these 5 exercises and then call me later.
I'm sure it's nice being your own boss too.
Yeah.
And patients
She's great.
patients have direct access to the great boss. So, you know, the boss never speaks badly about the boss these days, right?
No, she's really nice.
She's really nice. She's really good. Well, it's been a wonderful time talking with you these last 2 sessions, and hopefully, if you missed part 1 of our interview with Jeannie Miranda, please, check it out. Just go back on the network CNGN, and you'll see it under Focus On. And we wish you the best of luck. And Jeannie does do 20-minute telephone conversations, and it's free of charge. So I would urge all of you who have any aches and pains that are not going away to don't disregard them. Attend to them, because you don't want them to get bigger aches and pains. And Jeannie will point you in the right direction. If she can help you, she will. But give her a shout out at her new office, Turning Point Therapy. It's in New Hope, Pennsylvania, and I'm sure you won't be disappointed. So, Jeannie, thank you so much for coming on the show.
Thank you very much.
And for everybody else, I will see you next week on another edition of Focus On. I'm Lou Goldstein. Stay active, stay healthy, and stay well. And stay engaged, too. And I'll see you next week. Take care. Have a good night.